once again.
So I think we will start the meeting. I'll turn to our Chair and Secretary Becerra.
Excellencies, esteemed colleagues, let me extend a warm welcome to each and every one of you, to your teams. We hope each and every one of you enjoys your stay in Seattle and find it a fruitful engagement. It's my pleasure to host this 13th APEC high-level meeting of on health and the economy. We are privileged to have representatives in person from 17 of the 21 APEC economies, as well as partners and guests joining us here in the beautiful city of Seattle. I also want to extend my gratitude to Secretary Shaw from the state of Washington, who will join us shortly, for welcoming us here. And 30 years ago, it should be noted, Seattle helped host the United States' first APEC summit. This city has changed a lot in that time, but it has always been home to world-class research institutions, to hospitals and global health hubs. So it is only right that we are convening here again. We're happy to host and recommit to the success of APEC and other multilateral institutions. For this, the 13th high-level meeting on health and the economy, we will address issues of sustainable health financing and strengthening primary care for pandemic prevention, preparedness, and response. Without sustainable financing, we cannot ensure resilient, inclusive, and equitable health systems. Without strong primary care systems, our health systems and people are more vulnerable and less prepared for the next pandemic. So before we proceed, let me make a brief announcement. Let me turn to our chair's assistant.
Thank you. Just a brief administrative announcement. We would like to inform all members that this meeting will be recorded for note-taking purposes and to ensure that accurate information is captured for the summary report of the meeting. We would like to seek your consent to proceed with the recording. If you have any questions or objections to this, please let us know now. If there are no adverse comments, we will consider that you've given your consent to record this meeting.
Let's proceed then. We're here because as we rebuild from the COVID-19 pandemic, we must address the gaps and losses in health services from the past 3 years and strengthen our health systems for future pandemics. We need to ensure sustainability, resiliency, equity, and inclusion. Everyone, economies, civil society partners, philanthropies, businesses, must step up to build solutions that can prevent, prepare, and respond to future pandemics and other biological threats. Let us work together to explore the opportunities for digital health, to expand immunization programs, to treat mental health, to advance regulatory harmonization. Let's look seriously at global threats of antimicrobial resistance and the need for medical supply chain resiliency, the intersection of climate and health, and One Health and the economy. And let's continue our commitment to improve public health. We can move healthcare in our economies. We can move them from a system that treats illness to a system that promotes wellness. And if we do this and do this together, we will advance global health security and well-being. Once again, I welcome all of you. I look forward to our discussions today and to our continued collaboration within APEC. Let's strive together for a successful meeting and a healthier future for all of our economies. Thank you, and with that, let me welcome Dr. Umair Shah, Secretary of Health for the great state of Washington, for some welcoming remarks.
Thank you, Secretary Becerra. Thank you so much for your leadership and your invitation to be here this morning. I really appreciate it. Good morning, delegates. It is an honor to be here before you today. On behalf of Governor Jay Inslee and the great state of Washington, I want to say thank you to all of you. I want to thank again Secretary Becerra, as well as Assistant Secretary for Global Affairs, Lois Pace, my colleague and friend, for both your leadership and the invitation to address you this morning. I'm here to share my observations on the Washington state response to the COVID-19 pandemic, the importance of public-private partnerships, and the need for collective action against global health challenges. My name is Dr. Umair Shah. I'm the Secretary of Health for the Washington State, and I lead our state health agency with over 3,000 health professionals, along with our incredible colleagues across government. I also am joined by Dr. Tao Kwan-Get, our Chief Science Officer, who sits to my left here. Our agency believes strongly in the cornerstone values of equity, innovation, and engagement. These EIE values are key to everything we do. It starts and centers with equity, social factors we know impact our communities every single day. Innovation is so much more than just technology. We must think differently and creatively about solutions to myriad of issues. And we cannot do our work alone. Engagement matters. Throughout my career, I've responded to countless emergencies spanning well over 20 years, including hurricanes and flood events and tropical storms, chemical incidents, acts of terror, global earthquakes, and infectious disease outbreaks. And I served on the front lines of the COVID-19 pandemic, first in Houston, Texas, and then in Washington State, home to nearly 8 million people. This pandemic has touched every life across the globe. It's impacted all of us, our families, the people at work, at school, at home, in businesses, everywhere. It reveals the limits, and I'm hopeful the possibilities of our health systems, both public health and healthcare, as well as all the systems that contribute to health and well-being. Under the leadership of Governor Inslee, I'm proud to say that saving lives has been Washington's unwavering focus. Science and data have been our most trusted guides. We navigated through this threat and pushed back against this virus with collective action. Incredibly dedicated people from both the public and private sectors gave their time and expertise to support the fight against COVID-19. I started my current role in Washington the very week that COVID-19 vaccines arrived in our state. Immediately and urgently, we needed to scale up the distribution of these vaccines. And we could not even waste a moment. So how do we do it? Well, we did it together. Instead of going it alone, we work with public and private sector partners to help efficiently, effectively, and equitably get vaccines in arms. We believed no matter who you are or where you live in our great state, you should have access to these life-saving vaccines. I'm forever grateful to the amazing organizations, their leaders, their teams that have helped us face these problems and create solutions together. Fast forward, our state has had the 5th lowest death rate over the course of the pandemic in the United States, despite being hit hard with the first reported case just north of where we sit today, the first nursing home outbreak, and the first death in the United States. When the rest of the country was still planning, Washington State was responding. While there's a lot to discuss related to COVID-19, I want to highlight one point in particular. There was a surprising benefit to protective policies related to COVID-19. Requirements around masking and social distancing actually increased consumer spending and helped get the economy going again. To put it more directly, more economic activity occurred when people felt safe and healthy. Healthy people make healthy economies. And there's a direct relationship between the economy and a resilient health services system. Washington State is consistently ranked in the top 10 best in health system performance by the well-respected Commonwealth Fund. This is due to several factors, including our unwavering commitment to health insurance coverage, high marks in quality health care, our focus and dedication to reining in healthcare costs. We're also the first state in the United States to have a public health insurance option so our state government could offer more affordable coverage. Here in the United States, this is an important first step. Leadership and policies matter. For example, we use our state's immense purchasing power to buy directly the right kinds of services for 3 million of our residents. We align this with our other large healthcare purchasers like Boeing and Microsoft and Amazon, to name a few. Partnerships matter. Together, we focus on maternal and child well-being, health equity, digital health, primary care and prevention, and mental health care for our workers and workers across the nation and the globe. I cannot say enough about partners across state government, including our Health and Human Services Subcabinet, who work together every single day along with our federal partners, as well as our local and tribal health, our healthcare, and our private sector partners on behalf of our communities. We cannot do this work alone. In this regard, it's important to note that we are making significant progress in helping people live their healthiest lives by strengthening social services that lead to well-being. We continue to build out and invest in community-based health services with an emphasis on housing, food security, transportation, education, the environment, and behavioral health needs. We are learning from partners across the globe like you about the importance that social supports have on health outcomes, such as increasing our behavioral health care capacity, offering supportive housing and employment services for those experiencing homelessness and joblessness, investing in schools for our children, as well as education and learning opportunities for adults and kids alike, keeping elderly and their caregivers more supported at home, and coordinating services for those coming out of incarcerated settings, to name a few. Investments in health matter. Let me shift to a global perspective, and as I do, I appreciate you all making the long trip across this vast ocean or where you come from. I know firsthand the vast distances that separate the economies of the Pacific, but I also know more connects us than separates us. I'm originally from Asia myself, from Pakistan, the son of immigrants. My parents moved to the United States in the 1960s and taught me the importance of two things: to do good and to do well. Yes, we focus on being successful and doing well in all respects, but they taught us the importance equally of giving back to the people around us, to the world around us. Indeed, I bring this worldly perspective to my work, as it is truly the best of both worlds. I am the first Secretary of Health of South Asian descent in our state, and I cannot say enough about Governor Inslee recognizing the importance of diversity and inclusion in the choices of leaders he surrounds himself with. As we have seen, we are an ever-connected global community. We're only a flight or a few hours away from anywhere on the planet. This pandemic has shown us that like never before. The health and challenges of the people, the economies gathered here today face similar long-term challenges. Myriad effects of climate change, extreme weather, health and economic impact of aging populations, protecting the current and future well-being of our children, and addressing evolving bio-threats, to name a few. I believe strongly when we work together in global challenges, we can accomplish anything. Anything. Let me close by saying that the difficulties and challenges of this pandemic have taught us all the need to transform our systems. The world has changed, and we too must change. Not just our health systems, but all of our systems. Our department recently launched our transformational plan, A Vision for Health in Our State. If you are interested, we can absolutely get you a copy. In this plan, we have enumerated several key priorities, including health and well-being of our people, environmental health, resilience of communities in the face of emergencies, focus on our health systems and workforce, and global and One Health. We truly believe in the importance of global health in the state of Washington. Healthy people make healthy communities, make healthy economies, and make a healthier world for all of us. On behalf of the state of Washington, and my colleagues across our state and our nation, I am honored to address you this morning. We look forward to partnering with you, learning alongside you, and I hope your stay in our great state is nothing short of transformational. Thank you.
Secretary Shaw, thank you for joining us. Let me now turn to our ambassador, senior official for APEC at the U.S. Department of State, Ambassador Matt Murray.
Well, thank you, Chair, and good morning, everyone. On behalf of our entire U.S. APEC team, welcome to Seattle. Thank you for providing us with this opportunity to discuss the United States host year priorities for APEC. The United States is very excited to be hosting APEC again in 2023, and as the Secretary noted, we're especially excited to be back here in Seattle where we hosted the inaugural APEC Leaders Meeting in 1993. Our U.S. APEC 2023 theme is Creating a Resilient and Sustainable Future for All. And our 2023 host year specifically focuses on 3 overarching policy priorities: interconnected, innovative, and inclusive. So as we dive into our policy priorities and areas of focus for 2023, you will see that the cross-cutting concepts of building resilience, strengthening environmental sustainability, and advancing inclusive policies are woven across our priorities and our work. Our first policy priority is interconnected, building a resilient and interconnected region that advances broad-based economic prosperity. We believe that creating new connections and strengthening existing ties across the APEC region is at the heart of sustained economic recovery and will be critical for future growth and prosperity in the Asia-Pacific region. Of course, as has already been discussed this morning, COVID-19 highlighted the fragility of health systems worldwide and challenged our capacities to manage health emergencies, including the lack of robust and resilient supply chains, as well as vulnerabilities in healthcare systems. The APEC region has underlined the interconnectedness of health and sustainable economic growth. And today's discussion on sustainable health financing, on pandemic prevention, preparedness, and response, and primary health care will help bolster APEC's ability to build stronger and more resilient health systems in the APEC region. Our second priority is innovative, enabling an innovative environment for a sustainable future. Throughout this year, the United States has focused on health security and pandemic preparedness, digital health, strengthening immunization programs, supporting mental health, cancer prevention and control, including of cervical cancer, and regulatory harmonization and convergence. Innovative technologies and an enabling environment advanced through the United States' work in APEC these past few years on telehealth has helped maintain healthcare access during the COVID-19 pandemic. And APEC has a long history of working on health-related issues with strong private sector support, and we intend to continue this important partnership. Our third priority is inclusive, affirming an equitable and inclusive future for all. We recognize that to achieve sustained economic growth, we must ensure that all segments of our societies are able to fully participate in and benefit from an increasingly connected and globalized economy. Everyone, governments, civil society partners, philanthropies, and businesses must step up to continue the international effort to develop solutions to prevent, prepare for, and respond to future pandemics and other biological threats and advance global health security and health systems. To help drive our broader work on inclusion, we look forward to building upon ongoing health collaboration to address gender and health equity in the context of health systems. APEC will need to partner with the private sector to examine policy solutions to strengthen care infrastructure and ensure more equitable access to health services, address the burden of unpaid care work, and more fully recognize the value of domestic work. We have shared with APEC member economies our 3 implementation agendas for our 2023 host year, which address various challenges in a cross-cutting manner. They are the Manoa Agenda for Sustainable and Inclusive Economies, the Digital Pacific Agenda, and the Bay Area Agenda on Resilient and Inclusive Growth. The Manoa Agenda, inspired by the Manoa community in Honolulu, Hawaii, will continue the legacy of the U.S. APEC host year from 2011, which launched work both to promote green growth and expand economic opportunities for women in the region. Through the Manoa Agenda, the United States commits to working with other APEC economies in 2023 to build on APEC's existing commitments and work streams as identified in the Bangkok Goals, as well as to consider new aspirational objectives and opportunities to further APEC's sustainability objectives. The Digital Pacific Agenda will use APEC to support the responsible design, development, and deployment of emerging digital technologies, aim to secure digital access for consumers and businesses, work with the private sector to bring underserved individuals and small businesses into the digital economy, and help shape the rules, norms, and standards that govern the digital economy. And we're referring to this month in Seattle as APEC Digital Month, where many of the events, including in the Health Working Group, really are focused on digital issues. And then most recently, we introduced the Bay Area Agenda on Resilient and Inclusive Growth. This agenda aims to ensure that the work of APEC 2023 strengthens economic ties throughout the region and increases supply chain resilience while continuing to integrate the cross-cutting concept of inclusion. In particular, the agenda seeks to advance our efforts to focus on ensuring a robust and sustainable pandemic recovery, increasing preparedness for the future, and advancing resilient health systems and equitable health access. Importantly, for this esteemed group of ministers, it's clear that your work on health and the economy cut across all three of these agendas. And then on this last slide, you'll see our latest calendar. Of course, we're very excited to be hosting you all in Seattle for the third set of senior officials meetings and related meetings from July 29 to August 21st. And we look forward to welcoming economies to San Francisco from November 11 to 17, which of course will culminate with the APEC Leaders Meeting to be hosted by President Biden. And we will share more details on these events shortly after we wrap up here in Seattle. So thank you again for providing us the opportunity to give a brief overview of our host year priorities. We welcome any feedback or suggestions today or anytime throughout the year. We hope you have an enjoyable and productive stay here in Seattle, and our U.S. APEC team looks forward to continuing to work with each of you and your delegations. With that, I'll turn it back to the chair. Thank you.
Ambassador Murray, thank you very much. Let me now introduce Dr. Ted Chung, the Chief Technology Officer for Quanta Computer, and also the ABAC representative from Chinese Taipei.
Thank you, Chair, for the floor. Could I have my slides? Okay, on behalf of APEC Business Advisory Council, ABAC APEC, it is both my great honor and special privilege to present the APEC letter to APEC health ministers. Next slide. In recent years, APEC has paid considerable attention to health issues since before the COVID-19 pandemic and will continue to do so into the future. APEC members are also emphasizing the relationship between health issues and the business environment. As the pandemic has shown us, a robust economy necessitates a healthy population and society, and we are all, therefore, in the same boat. APEC is eager to share with the distinguished delegates of HLMHE regarding its recommendations. The vital belief is that health is the fundamental human right and essential to achieving the APEC Putrajaya Vision 2040. More specifically, the APEC letter is concentrating on digital health and parts of pandemic response, recovery, and preparedness. Today, I will summarize the main topics of the APEC letter. Next slide. With regard to digital health, APEC considers the digital health technology and innovations are changing the way healthcare is delivered, diagnosed, and treated. A major area is interoperability of health data. Data sharing of digital health data and electronic medical records are crucial to activate and accelerate the digital transformation of future health care and ecosystem. Another significant area is artificial intelligence in healthcare. AI, augmented reality, virtual reality, Internet of Things, IoT, digital therapeutics, advanced networking like 5G or 6G, cloud computing, big data, and AI algorithms can promote predictive, preventative, personalized, and precision healthcare. Next slide. In addition, APEC letter has centered on telemedicine or telehealth. Through advanced telemedicine, we could connect more people to access the right care anytime, anywhere. In addition, by connecting hospitals and clinics with different professional capabilities and medical resources, we could be able to enhance the resilience of healthcare network and foster greater cross-border collaboration. Moreover, APEC supports the notion that digital trust and security will strengthen privacy-preserving telemedicine through a collaboration with health big data in APEC region. Next slide. The issue of pandemic preparedness and response is also of great importance to APEC. In particular, APEC has met the recommendation with regards to economic impact of the COVID-19 pandemic. APEC seeks to remind APEC that it mustn't suffer pandemic amnesia in which healthcare systems could be unprepared to mitigate a new pandemic or resurgence of COVID-19. Furthermore, APEC wants to advance supply chain resilience in healthcare. APEC calls for further strengthening of public-private partnership to enable greater responsiveness and resilience in healthcare systems. Next slide, please. Last, I would like to share with you our new APEC Digital Health project led by myself. The project seeks to minimize the digital divide of both digital skill and digital infrastructure needed to maximize the value of AI in health by transforming data intelligence into artificial intelligence for smart medicine and precision health. The Do AI Yourself training workshop was held in June virtually over Quanta Research Institute AI Medical Cloud Platform, QUOCA AIM. The hands-on session ensured that non-IT background medical practitioners gain practical knowledge and skills to generate AI models through machine learning without coding. Next slide. Our idea is that if we view data as water and AI as fish in the water, the whole process of machine learning is just like fishing. We try to coach people how to do fish in their own data lake rather than give fish. The APEC Digital Health Project has been implemented since 2021. Please access the project website for more information at digital-health.site. Next slide. We believe that the best is yet to come, and along we go fast, together we can go faster and further. Thanks for the chair for the floor, and thanks for your attention.
Dr. Chung, thank you very much.
I would like to make one more administrative announcement. We would like to thank the press who have been in the room with us for this portion of the opening plenary for being here. The remainder of this meeting will be closed to the press. Thank you.